Lesson 1, CDS, Introduction to Medication Support, an overview of direct support roles in medication support. After completing this lesson, you will increase your understanding about advocacy, working with medical professionals, and verbal orders. Teaching and encouraging independence. Everyone should be provided the opportunity to learn how to administer his or her own medication. Staff should make the administration process a learning experience. This may also increase skills in other areas of life, example learning time, colors, counting, etc. Involvement and participation are important, no matter how much support is required. Obviously, individuals will differ greatly in their ability to participate. However, everyone should be involved in some way. This is your responsibility. Encourage independence. 1. Have the person do as much as possible. 2. Review with the person what she or he is taking and why. 3. Prepare medication for one person at a time. 4. No yelling of names or that it's medication time. 5. No bells or intercom systems. 6. Draw as little attention to the process as possible. And 7. Keep it confidential and private. The medical appointment. Information for the doctor. For the best treatment, the doctor must have several pieces of information. With the aid of the following information, the doctor will have a better opportunity to offer maximum help and minimize potential dangers. You are responsible for knowing where this information is kept. Information for the doctor. 1. The reason for the visit. 2. Medical records. 3. Allergies. 4. Current medications and purpose. And 5. Updates. Information for the doctor. The 5 types of information which should be provided to the prescriber are 1. Reason for the visit. Written observations of recent changes in objective, subjective, or behavioral signs. This information may be gathered from daily logs, seizure records, incident reports, etc. All information should be brought with you to healthcare appointments. 2. The individual's medical records. It is impossible to know the types of information the healthcare professionals may want to know. Communicating all medical information between all healthcare professionals is essential. Some pre-existing conditions may greatly influence the doctor's choice of treatment. 3. Allergies. Allergic reactions can be fatal. It's important that any allergy is brought to the attention of the person's healthcare provider. This includes allergies related to foods, medication, insects, and the environment. 4. Current medications being administered and for what purpose. Prescription, prescription PRN, and over-the-counter. The prescribing person needs to be made aware of all medications a person is taking and the administration times. Mixing medications can result in a variety of unwanted effects. 4. Are there any unwanted effects that this medication is likely to have? All medications have the possibility of causing effects other than the reason we are taking it. We want to know what we should specifically look for when taking this medication. Even if the unwanted effect is common or predictable, such as getting sleepy with an allergy medicine, we want to know so that we can tell if the person's response is worse than expected. 5. Updates. Provide updates on medical or dental conditions currently not being treated by medication. Example, hypertension, arthritis, heart disease, etc., as well as information on recent hospitalizations like sprained ankle or influenza, etc., and surgeries like gallbladder or appendix, etc. Encourage participation. Support the person to communicate what is wrong. Remind the healthcare professional to speak to the individual and model respectful behavior. Encouraging participation. Support the person to communicate what is wrong. Individuals differ greatly in their ability to represent themselves. Some individuals need minimal support from staff, example, transportation, assistance with documents, etc. Others may require more support from staff. Encourage the healthcare professional to speak to the individual. Some of the healthcare professionals you meet may not have experience working with individuals with developmental disabilities. All effort should be made to include the person in any conversations. Encouraging participation. Before the appointment, staff discuss what will occur, questions that may be asked, and what the person wants to let the medical professional know. If what the person is saying differs from known observations, you will need to respectfully discuss this with the person and the healthcare professional. Model respectful behavior. When you show respect and have a positive attitude towards the people you support, you are being a good role model to others. Wrong way. You describe all the individual symptoms and behavior changes. Right way. Encourage the individual to provide his or her own description first and you fill in later. Wrong way. You interrupt, disagree, or argue with the individual over answers to questions. The right way is respectfully communicate factual information to the medical professional. The wrong way, you answer the doctor's questions without waiting to give the individual a chance. The right way, always allow the individual to answer first. If necessary, redirect the doctor's question to the person. The wrong way, you ask the doctor all the questions about any effects, how long it should take to see results, etc. The right way is encourage the individual to ask all the questions he or she can remember, then you ask the rest with permission from the individual. Wrong way, you go to the pharmacist and have the prescription filled without the individual. The right way, have the doctor give the person the prescription and provide the assistance if necessary to have it filled. Discussion with doctor. What are the treatment options? Can this medication be prescribed in a way that fits in with the person's home and work schedule? Remind the doctor of the person's insurance. Is the medication going to be covered? If it's not covered, is there another medication that would work as well that is covered? And advocate. Important discussions to have with the doctor when a medication is prescribed. 1. What are the treatment options? Not all symptoms need to be treated with medication. For example, the best treatment for cold symptoms may be rest and plenty of liquids. Medication may not be needed and could even prolong the symptoms. Be sure to discuss all treatment options, including those that may not involve medication. 2. Can this medication be prescribed in a way that fits with the individual's home and work schedule, including sleeping late on weekends, working in the community, etc.? 3. Remind the doctor of the insurance plan the person has. Ask these questions. Is this medication going to be covered by the individual's prescription plan? If the medication is not covered by the individual's prescription plan, is there another medication that would work as well that would be covered by the individual's prescription plan? 4. Advocate. You may need to contact your supervisor to handle a situation. Inform the doctor if the person needs a liquid, chewable, or another form of medication. Ask the doctor 6 important questions. 1. What is the purpose of the medication? 2. What is the desired effect of the medication? 3. What is the response time? 4. Are there any unwanted effects that this medication is likely to have? 5. Are there any special instructions? And 6. Are there any interactions with other medications, food, or the environment to be aware of? Information to get from the doctor about the chosen medication. If a medication is prescribed, ask 6 important questions about the medication. Get the answers in writing and do not rely on your memory. Review the answers with the pharmacist. Your agency may have a form that includes this information. Check with your agency for specifics. 6 important questions. 1. What is the purpose of the medication? What is the medication being prescribed for? 2. What is the desired effect of the medication? How will we know if it's working? Are we looking to lessen symptoms someone is feeling or to prevent something? 3. What is the response time? How long will it take this medicine to start working? Some medications may take weeks to reach a level where improvement will be seen. Others may only take a few days or even hours. 5. Are there any special instructions? Storage. Should this medication be stored in a special way, such as in a refrigerator or never in an area that is too hot? Is it a controlled substance? Not all pharmacies note on the bottle if a prescription is a controlled substance. We want to be sure to know if it is so we can follow extra safety precautions. Administration. We also want to know if the medication needs to be taken on an empty stomach, with food, with milk, etc. 6. Are there any interactions with other medications, food, or the environment to be aware of? How will this medication react with other medications the person is already taking or that is being prescribed at the same time? Interactions can be very serious, so knowing all of the medications that a person takes will help the doctor avoid them. Documentation to get from the prescriber. It is required that agencies have a signed order on file for each medication being administered. The most common forms of a signed order are the original and copy of the prescription, the doctor's visit or medical consultation form, signed discharge papers from a hospital, printout of electronic prescription or e-script. Regardless of the type of documentation, remember that it must be signed by the prescriber. Staff must write or stamp the word copy on the copy of the prescription or printout of the e-script. This copy should be kept in the person's section of the medication book. Some agencies may require more than one form of documentation. For example, an agency may use a doctor's visit or medical consult form that needs to be completed by the individual or the staff supporting the person with information about why the person is seeing the healthcare professional. The healthcare professional would then be asked to make notes about anything done during the visit, including any medication changes, additions, or discontinuations. However, the agency may still require a copy of the written or electronic prescription for filing in the medication book. Check with your agencies for specifics. If a medication is discontinued and that is the only information on the signed order, you can file the original and provide a copy to the day program if medications are also administered there. Typically, it'll be stapled to the medication sheet and filed at the end of the month. Understanding the medication. Having the documentation and understanding it can help us safely administer the medication. Read and fully understand all the information on the prescription. If there is anything that seems confusing or is unclear, ask questions before leaving the prescriber's office. Verbal orders and telephone orders. Verbal orders occur when you speak to a doctor over the phone and she or he changes an individual's medication or treatment. Example, fasting for blood work, continued use of crutches, etc. Electronic prescriptions. Electronic prescriptions or e-script are when the prescriber sends the prescription information directly to the pharmacy electronically. Electronic prescriptions can also be referred to as e-prescribing or e-Rx. When electronic prescriptions are used, the staff must ask for a printout of what was sent to the pharmacist. The printout typically includes all the medication changes, additions, and discontinuations on one page. Staff should be sure that they ask the prescriber to sign the paper if there is not already a signature, write or stamp the word copy on the printout, and keep the copy in the medication book. If the printout cannot be obtained at the time of the medical appointment, the person who receives the printout must review it for accuracy and contact the prescriber if there are any questions. Confirmation of verbal orders. When speaking to the prescribing person on behalf of someone with a disability, make sure to have their medical information available. Example, allergies, weight, current medication, and administration times, etc. Your responsibility as the person accepting the verbal order is to write down the date, name of the individual, medication, dosage, time, and route. It is important to read back the verbal orders to the prescribing person to make sure that you have the right directions. The instructions given in the verbal order must be followed immediately. The information must be written on the medication sheet immediately. Example, discontinue, skip a dose, continue as prescribed, new medication is added, etc. A signed and dated confirmation of the verbal order must be received from the prescribing person within 24 hours or the next business day. Follow your agency's policy regarding how verbal orders are documented and where they are kept. Example, in the critical log, individual log, etc. You also need to tell other staff members about the verbal order. If there's a medication change, the label will not match the new order. Do not change the original pharmacy label. You will need to get a new pharmacy label from the pharmacist within 24 hours or the next business day. The prescription and pharmacy label must match.